To begin, I want you all to consider this. Imagine a world where a child's potential is limited not by their physical condition, but by the barriers we as a society and a care system place in their way. This is the reality for many children within our health and social care systems. My name is Leroy, and I'm part of a team of 6 dedicated to exploring this vital topic today, which is physical disabilities in children in health and care settings. A physical disability is a long-term condition that limits a person's physical functioning, such as mobility, stamina, or dexterity, and has a substantial negative effect on their ability to carry out normal day-to-day activities. In this slide, we'll start with a quick introduction. Children with physical disabilities often face challenges in getting equal access to health, education, and social activities. That's why inclusion is so important. Every child deserves the chance to grow and develop fully. Health and social care professionals need to work together to meet each child's needs. Support can be physical, emotional, educational, or social. All these areas help children live healthier and happier lives. Now, let's look at some common types of physical disabilities, such as cerebral palsy, spinal bifida, muscular dystrophy, spinal cord injuries, juvenile arthritis, and limb differences. Each of these conditions affects movement and daily activities in different ways. So understanding them helps us give better care and support. Now that we have set the stage and outlined our purpose, I'd like to hand over to Natalie Ngalula, who will provide a critical analysis of the background and context surrounding physical disabilities in children within these care settings.
This slide is about understanding disability in a child from both a physical and social point of view. In the last past, child with a physical disability was often excluded from school and community life. There was a belief that could not fully taking place in the everyday activity and result of the opportunity to learn was very limited over the time. The attitude have changed today. Socially plays for more important and including and making sure all the child have equal chance to participate in the UK. The shift is also reflects to how we think about disability, moving away from media model, which is view disability as something wrong with the child. Today, as a model, we are focused on the brief in the sociality and attitude that make life more difficult. Several key of law have this to cover the chance, this disability discrimination from Act of 2019, where was over the manual step in protection from the rights of disability people. Later in the Equality Act of 2010, straight for the potential and making it clear that the school and the server must make reasonable obsession to support disability child. Today, the support go beyond legislation. There is a strong focus on early intervention and including education and family and social care, which make work close with the family to give the child the best opportunity to start and ensure they feel activity. Cultural affecting care for the child with disability, difficult and culture view disability in a different way in some family. As a family disability might be seen as something shameful and they can be pressure to hide it. This making it harder for a child to accept the support for the family see the help. Overculture, however, have a strong support from the family and wide community, extras, extremely family and the neighbors might be act role to in the care for the child, provide emotional and practical support in the UK. They've the focus is on equal and including family are encouraged and support to access to the care they need. They are ongoing affecting to raise awareness of understanding how disability in socially. Health and social care team work closely together to help child children to the team approaching can be including the doctor, therapy, and social worker. All the worker to making sure the child did it meets the key is to provide care, respects, clear communication, and cultural sensitivities. By understanding each family culture background and working in partnership with them, professional can ensure that the child receives the best positive care in the way they feeling support and appreciate for the whole family.
It's very important to identify physical disabilities in children as early as possible because early support can make a significant difference in place during the most critical stage of growth. However, physical disabilities aren't always obvious at first. Some signs can be very subtle, so parents and teachers might not recognize them right away, even when the concerns are noticed. Getting referred to the right specialist can take time, which delays the start of support. Access is another big issue. Not all families have the same opportunities to reach diagnostic services. Long waiting lists, transporting challenges, and fewer clients in rule of understanding areas can create real barriers for families seeking help. Despite these challenges, early intervention truly makes a difference. Programs like physiotherapies and occupational therapy can improve a child's independence, physical abilities, and overall quality of life, especially when they begin as early as possible. Children with physical disabilities often need support from many different professionals. This can include doctors who manage their medical needs, therapists such as physiotherapists and occupational therapists, and social workers who help coordinate services. Many children also depend on specialist equipment like a wheelchair or mobile aid to support their independence and daily activities. However, accessing this care isn't always straightforward. Families often face long waiting lists for assessments and therapy. In some areas, there simply aren't enough specialists, meaning services may only be available in certain client or regions. This can lead to delays, and sometimes families have to travel long distance just to get an appointment. There are also important financial and practice challenges. Travel costs taking time off work, and in some cases paying for private therapy can make it difficult for families to access consistent care. These barriers can affect how quickly a child gets the support they need. Although the UK has policies such as the Children and Families Act 2014 that aim to make access to healthcare and support fair and equal, gaps still remain to practice. Not all children receive timely help, and many families continue to face significant obstacles. And now I hand over to Azim, who will be taking you through the next step of slides.
I'll be talking about the inclusion of the children with physical disabilities in school and the wider community, the challenges they face, and why collaboration is so important to ensure every child can reach their full potential. Including children with physical disabilities in school activities and the wider community can be significant challenge. Despite progress, many children face barriers that make participation difficult. These barriers can include negative attitudes, low expectations, or even bullying. On the top of that, physical obstacles like buildings or transport that are not accessible can prevent children from fully joining in. These challenges don't just affect access, they can also impact a child's confidence, mental health, and social development. A child feels excluded may struggle to make friends, participate in learning, or feel valued. Families too often experience stress and worry, concerned about their child's safety, opportunities, and independence. So, truly support these children's collaboration is essential. Health and social care professionals, schools, and families must work together to ensure children can take part fully in learning, play, and community life. When we create inclusive environments, we help children feel valued, enabling them to reach their full potential. Every child deserves the chance to learn, grow, and thrive. And inclusion is the key to making that progress. And inclusion is the key to making that possible. So now we will be looking in critical analysis, statistical data. Here you can see in the chart, globally, physical disabilities affect a significant number of children across different age groups. Among the youngest children, those aged 0 to 4 years, approximately 28.9 millions are reported to have a disability, which is about 4.3% of the children in the same group. As children grow older, the number increases significantly. For those aged 5 to 17 years, around 207.4 million children are affected, representing 12.5% of this age group. When we look at the broader picture, including all the children and the teenage from 0 to 19 years old, roughly 266 million children, or 16%, live with some form of disability. These statistics highlight not only the prevalence of disabilities among children worldwide, but also the importance of early identification and support. Providing access to health service, inclusive education, and social care is crucial. By addressing these needs, we can help children with disabilities reach their full potential, participate meaningfully in their community, and live fulfillingly lives. These numbers remind us that inclusion is not just a goal, it's a global responsibility. I will now hand over to my colleague who will take us through the next section, which is practical implication. Thank you.
We will be looking at practical implications. In practice, children with physical disabilities face several challenges that health and social care professionals must manage. Early diagnosis is very important because it helps prevent long-term complications and allows children to receive the right care as soon as possible. Some children who have been in intensive care develop post-intensive care syndrome, or PICS, which can affect their physical abilities, mental health, and daily functioning. Others may experience cognitive or psychiatric difficulties, such as anxiety, attention problems, or depression, sometimes as a result of illness or trauma. To support these children, health and social care teams need to provide ongoing therapy and emotional support. This often involves doctors, therapists, educators, and social workers working closely together. Coordination is key to ensure the child's physical, emotional, and educational needs are all addressed. Families also an essential of care. They need guidance, training, and counseling so that they can support their child at home effectively. Finally, inclusive plans in schools and community programs help children regenerate, build confidence, and participate fully in everyday life. In a real world case study, the things that may be faced are something like this. This case study comes from Paladi that wanted to make physical activities accessible to all children, including those with physical disabilities. They created sports and activity programs that were designed so every child could participate safely with support if needed. To make this work, staff from different services had to work together. Doctors, therapists, social workers, teachers, and leisure staff all joined forces to plan and run the programs. First, the project faced several challenges. There was limited funding, which made it hard to provide all the equipment and staff needed. The administration and paperwork were complicated, and not all staff had training to support children with disabilities. Some children still had difficulty accessing activities because of these issues. Despite the challenges, the program had very positive outcomes. More children were able to take part in physical activities, which helped their confidence, social skills, and overall well-being. It also improved coordination between different health, social care, and education services. Families were more involved and felt supported, and staff learned new skills for helping children with disabilities. This case shows that even with challenges like funding and training, practical, well-coordinated efforts in health and social care can make a real difference in children's lives. It highlights the importance of teamwork, inclusion, and planning when designing services for children with physical disabilities. So now I would like to hand over to my colleague, Seclain, who will come with the conclusion.
I will now discuss the key practical implication and recommendation based on the issue we have covered. We talk about there are several practical steps that health and social care practitioner can take to support children with physical disabilities. First, it's very important to use multidisciplinary team. This means that doctors, nurses, therapists, social worker, and teacher all work together. When professionals share their ideas and plan as a team, the child service is better and more complete care. Second, service should be accessible and child friendly. This includes things like ramp, adapted equipment, clear sign, and when places are easy for children to use, they feel more comfortable. Families also feel welcomed and supported. Third, we need to focus on early diagnosis and early intervention. When we identify disabilities early, children can get support sooner. Early therapy and early help can greatly improve a child development and future outcome. Fourth, it is important to involve children and their family in decisions. Family know their child best. Listening to their ideas and respecting their cultural background help make care more practical and more meaningful. It also help families continue the sport at home. Finally, staff need ongoing training. Practitioners should understand disability, inclusion, and equality so they can give high quality care. Training helps reduce mistakes, improves communication, and makes the experience better for both families and professionals. These steps can help create a system that is supportive, respectful, and inclusive for every child. Finally, I want to finish by summarizing the main point of presentation. To conclude, I want to highlight the main message of the presentation. Every child, no matter their physical ability, deserve to feel included, valued, and supported. Inclusion is not optional. It's essential for a child's well-being and development. When disabilities are detected early and the right support is provided, it can change a child's life. Early intervention does not just address challenges, it helps children grow, build confidence, and reach their potential. It also gives families the guidance and hope they need. Teamwork is also very important. No single professional can support a child alone. Health and social care professionals need to work together, sharing ideas and planning care that looks at the whole child, not just the disability. This makes sport more consistent and meaningful. Cultural understanding matter as well. When professionals respect a family's belief and background, it builds trust, and when family feel understood, they are more comfortable asking for help and taking part in their child care. Finally, Inclusion is a shared responsibility. Teacher, doctor, caregiver, and the whole community all play a role in making sure children with disability have equal opportunities to learn, grow, and enjoy life. If we work together with empathy and commitment, we can create a world that is more supportive, kinder, and truly inclusive for every child. Thank you.